I'm Dr. Eric Smith, and I'm working with the Alzheimer Society of Calgary. I'm here today to answer some of the most common questions that people have about dementia. This video is made possible by the support of the Roman Catholic Diocese.
What treatment options are available?
Unfortunately, most causes of dementia are not curable, so there are no treatments to cure the dementia. For patients with vascular dementia or with a vascular component to their dementia, vascular disease can be prevented by having vascular risk factors managed by your doctor. So that includes treating things like hypertension or high cholesterol levels. Unfortunately, for the most common cause of dementia, Alzheimer's disease, there's not yet a disease-modifying treatment. However, there are medications that can help with some of the symptoms, equivalent to providing a temporary boost of about 6 months of progression to patients. The Health Canada approved medications for Alzheimer's disease include 3 types of medications that are called cholinesterase inhibitors. The names of those medications are donepezil, which sometimes goes by the brand name of Aricept, galantamine, which goes by the brand name of Remenil, and rivastigmine, which goes by the brand name of Exelon. These medications increase levels of a neurotransmitter called acetylcholine that help brain cells communicate with each other. So although they don't prevent brain cells from getting sick, they help the remaining brain cells communicate better, which can have the effect of improving memory. Unfortunately, the response between individuals is somewhat variable, and not everybody has a good response to these medications. There is another Health Canada approved medication for Alzheimer's disease called memantine, which also goes by the brand name of Abixa. This medication acts on a different brain receptor, so some patients may be on a cholinesterase inhibitor as well as memantine. Memantine is better for the more moderate to severe stages of dementia. Unfortunately, it's not covered by Seniors Blue Cross insurance in Alberta, so it's a medication that would have to be paid for by private insurance or out of pocket. You should discuss the use of these medications with your doctor if you've been diagnosed with Alzheimer's disease. Some of the consequences of dementia can be treated with medications as well. These consequences include symptoms like depression, anxiety, or agitation. If you're experiencing some of those symptoms, you should also talk to your doctor about medication options.
Beyond medical interventions, what approaches are there for helping people with dementia?
There are other approaches besides medications to help people cope with dementia as well. I encourage everyone to contact the Alzheimer Society. You may also ask your doctor to contact the Alzheimer Society on your behalf through the First Link referral program. Part of living with dementia is living a healthy and good quality of life. Persons with dementia should stay mentally active. We encourage people to get physical activity, which has turned out to be maybe the most modifiable and common risk factor for cognitive decline in the Canadian population. Ideally, people should get a half-hour of exercise 5 days a week or more. Diet can have an important link to risk for dementia. We encourage people to eat fruits and vegetables, ideally 5 servings a day, and there's some evidence that a more Mediterranean-style diet, rich in fish and olive oil, with 1 serving a week or less of red meat, may help prevent dementia and might help slow the course of dementia as well.
Often, someone with dementia becomes withdrawn or unwilling to participate. What are some things people can do to help keep them engaged?
Inability to engage in previously enjoyable activities is a very common symptom in dementia. When this happens, we think about several different potential causes. One is depression that can be either a consequence of the disease directly, or that could be part of the adjustment to living with dementia. There are treatments for depression, so please mention this to your doctor and they may be able to help. But these symptoms can also be due to something called apathy, which is a medical term for the lack of motivation to do things that is a direct consequence of the diseases of dementia on the brain itself. It's important to offer the opportunities to engage in previously enjoyable tasks, But it's also important to recognize that the ability of the person to participate in these activities may be limited by the disease itself. It's not a failure of the caregiver when the person is unable to participate in previous activities. It may simply be related to the progression of the disease.